Many women over 60 often tell me the same thing. I still brush my teeth every morning and night, so why does my breath still smell bad? It sounds like a simple question, but behind it lies a truth very few people know. Bad breath doesn't just come from your teeth. It often starts with small habits in how you care for your mouth every single day. As we age, our bodies change, and so do our mouths. Saliva production decreases, gums become more sensitive, and odor-causing bacteria can grow faster than ever, especially if we keep following the same old routines. In today's video, I'll share with you 8 common oral care mistakes that most women over 60 make, often without realizing it. These mistakes not only take away the freshness of your breath, but can also damage your gums, weaken your enamel, and even affect your overall health. But here's the good news. Once you recognize and correct them early, fresh breath and a confident smile can absolutely return, no matter your age. Let's start with the first mistake. Brushing your teeth the same way you did at 30 or 40. I know it's a habit you've had for decades, using a hard bristled brush, scrubbing forcefully, believing that the harder you brush, the cleaner your teeth. But what many people don't realize is, your mouth at 60 is no longer the same as it once was. As we age, our gums become thinner and more fragile. Tooth enamel isn't as thick or resilient as before. If you keep brushing aggressively, like you're fighting plaque, every stroke is actually wearing down your teeth's natural protection. And when enamel wears away, it exposes the root surface, creating tiny grooves that become the perfect hiding spots for odor-causing bacteria. I once met a patient named Linda, 68 years old. She had beautiful white teeth, but constantly complained about bad breath and tooth sensitivity whenever she drank cold water. When I examined her, the cause was simple. She was brushing too hard and using a stiff bristled brush. After switching to an ultra-soft toothbrush and brushing gently in small circular motions, within just 3 weeks, her breath felt completely different. So if you want to protect your smile and your breath, remember, brush gently, don't scrub. Use a soft bristled or sensitive gum electric toothbrush. Replace your toothbrush every 2 to 3 months because worn bristles can harbor bacteria. With just this small change, you'll help your mouth heal and restore the freshness of your breath day by day. Now let's move on to the second mistake. One of the most common reasons your breath smells unpleasant: skipping tongue cleaning. Many people think brushing their teeth thoroughly is enough, but in reality, more than 70% of odor-causing bacteria live on the surface of the tongue, not the teeth. Imagine this. After every meal, dead cells, food debris, and bacteria accumulate, forming a thin white or yellowish coating on your tongue. That coating is actually the main source of bad breath, no matter how well you brush your teeth. I once treated a 72-year-old patient named Helen who always covered her mouth when speaking because she was embarrassed by her breath. She tried everything: mouthwash, mints, even specialized breath-freshening sprays. But it wasn't until I showed her how to gently clean her tongue each morning that things completely changed. Just 1 week later, she came back and said, "Doctor, I feel confident again. My granddaughter told me my breath doesn't smell like medicine anymore." Cleaning your tongue is simple. Use a tongue scraper or the textured back of your toothbrush. Gently scrape from back to front. Avoid pressing too hard. Rinse your mouth afterward with water or an alcohol-free mouthwash. If you do this every morning, it takes only 30 seconds, yet the freshness can last all day. So don't let your tongue become the forgotten zone in your oral care routine. It's one of the most powerful secrets to keeping your breath fresh after 60. Next comes the third mistake, and it's something I see very often in women over 65. Not properly cleaning dentures or removable plates every day. Many people believe that simply taking their dentures out, rinsing them with water, and leaving them to dry overnight is enough. But here's the truth. The surface of dentures is like a tiny sponge. It's full of microscopic pores where bacteria and fungi can easily hide. If not cleaned thoroughly, dentures can quickly become a source of odor inside your mouth, even if they look shiny and clean on the outside. I remember one of my patients, Mrs. Thompson, 74 years old. She told me, "I brush twice a day and rinse after every meal, but my husband still says my breath smells strange." When I asked further, she admitted she had never soaked her dentures overnight. She thought it would damage them. After I taught her how to soak them in a proper cleaning solution and gently brush them every evening, within just a week, the bad odor completely disappeared. So if you wear dentures or removable plates, remember these 3 golden steps. Remove and rinse them immediately after eating. Soak them overnight in an antibacterial cleaning solution or warm water with a cleansing tablet. And never sleep with your dentures in. It allows bacteria to multiply and can inflame your gums. By cleaning your dentures daily, you're not only keeping your breath fresh, but also preventing oral infections and candida overgrowth, 2 common causes of that unpleasant medicine-like or metallic smell often noticed in older adults. The 4th mistake I want you to pay special attention to is ignoring the signs of dry mouth. When we're younger, we rarely think about saliva, but in reality, it's the most powerful self-cleaning system your mouth has. Saliva doesn't just wash away food debris, it neutralizes acid, suppresses bacteria, and keeps your gums and oral tissues properly moisturized. However, after age 60, your salivary glands often slow down due to hormonal changes, medications, or simply drinking less water throughout the day. When saliva production drops, your mouth becomes dry. And that's when odor-causing bacteria thrive. I once had a patient, Margaret, 71 years old, who often complained, "Every morning my mouth feels like a desert." After reviewing her case, I discovered she was taking both blood pressure and allergy medications, 2 common culprits that reduce saliva flow. With a few simple lifestyle adjustments, within just 2 weeks, her dry mouth improved significantly. If you're dealing with the same issue, here are a few simple but effective tips. Sip water frequently. Small sips throughout the day are better than large gulps at once. Avoid alcohol-based mouthwashes. Alcohol dries out gum tissue and kills beneficial bacteria. Chew natural xylitol gum or a small slice of lemon to stimulate saliva production. Practice nose breathing instead of mouth breathing. Mouth breathing releases moisture and dries your tongue and lips. And if you're taking medications, ask your doctor if there's an alternative with fewer dry mouth side effects. Because when your mouth stays properly hydrated, bacteria have far less chance to grow. Your breath stays lighter, and you'll feel more comfortable and refreshed all day long. The 5th mistake I often see, especially among women over 60, is overusing alcohol-based mouthwash. I understand why. Many people believe that the stronger and more burning the mouthwash feels, the better it kills germs and freshens breath. That tingling, fiery sensation makes us think bacteria are being wiped out. But in reality, the opposite is true. Alcohol in mouthwash works like a harsh disinfectant. It doesn't just kill odor-causing bacteria. It also destroys the good bacteria, the beneficial microbes that keep your mouth's ecosystem balanced. When those friendly bacteria are wiped away, harmful bacteria return even stronger, leading to that distinct chemical smell, a burning tongue, and over time, thinner, more sensitive gums. I once treated a patient named Eleanor, 66 years old, who was very proud of her oral hygiene routine. She used alcohol-based mouthwash 3 times a day, morning, noon, and night, believing it kept her mouth clean and fresh. But after a few months, she began noticing dryness, a rough tongue, dull taste, and a lingering scent, almost like antiseptic. When I examined her, her oral lining was slightly irritated, and her mouth's microbiome was almost completely unbalanced. After she stopped using alcohol-based mouthwash and switched to a gentler, alcohol-free formula, within 2 weeks, everything changed. Her mouth felt comfortable again, and her breath smelled naturally fresh. So, if you're using mouthwash daily, keep these rules in mind. Choose alcohol-free options, or those with natural ingredients like peppermint oil, aloe vera, or zinc. Use it once or twice a day, not after every meal. And most importantly, don't try to mask bad breath with mouthwash. If your breath consistently smells unpleasant, that's a sign of an underlying issue, one that needs to be addressed, not just covered up with chemicals. True freshness comes from a balanced, hydrated, and healthy mouth, not from the temporary scent of alcohol or artificial mint. The sixth mistake is ignoring the early signs of gum disease or gingivitis. Many older women believe that as long as their gums don't hurt, everything is fine. But the truth is, gum disease rarely causes pain in its early stages, which is exactly why it's so often overlooked. A metallic smell, a faint bloody taste, or gums that look slightly red or swollen. These are all early warning signs that bacteria are growing beneath the gum line. I remember a patient named Clara, 70 years old. She didn't come to me because of pain, but because her husband told her that her breath smelled like blood. When I examined her, I found mild gum inflammation, light bleeding upon touch, and small periodontal pockets around her front teeth. What's surprising is that she felt no pain at all, just a little discomfort when brushing. After a gentle deep cleaning treatment and proper oral care guidance, her inflammation subsided, and her breath returned to normal within about 3 weeks. That's why I always remind my patients, don't wait until your gums hurt or your teeth become loose to see a dentist. If you notice bleeding while brushing or flossing, that's already an early sign of gingivitis. And if your breath carries a metallic or warm, unpleasant scent, get your gums checked as soon as possible, because once gingivitis progresses into periodontitis, bacteria start attacking the bone that supports your teeth, leading to tooth loss and much stronger bad breath. The good news is that gum disease is fully reversible when caught early. Gentle daily hygiene, cleaning between teeth, and regular dental checkups every 6 months can help you keep your smile and your breath healthy and fresh well into your 80s and even 90s. The seventh mistake, something many people unknowingly make every single day, eating odor-causing foods but not properly cleaning the mouth afterward. You might think, it's just a little garlic, just 1 cup of coffee, what's the harm? But after 60, when saliva production slows down, food odors can linger twice as long as they did when you were younger. The most common culprits are coffee, onions, garlic, spicy sauces, and sugary foods. These all create an ideal environment for bacteria to break down proteins in your mouth, releasing sulfur compounds that cause that distinctive bad breath you may not notice, but others definitely do. I once had a patient named Gloria, 69 years old, who loved her strong black coffee every morning. She told me that even though she brushed her teeth right after breakfast, her breath still smelled off. When I asked about her routine, she said, "I brush right after my coffee." And that, right there, was the problem. Brushing immediately after drinking coffee or acidic foods weakens enamel because acid still coats the surface of the teeth. Instead, I suggested a simpler and safer approach. Drink a glass of warm water or chew a fresh apple slice after meals to neutralize acid and naturally clean your mouth. Rinse gently with plain water, then wait 20 to 30 minutes before brushing. And if possible, finish your meal with a cup of green tea, since its polyphenols help neutralize odor and gently reduce bacteria. After just 10 days, Gloria came back smiling and said, "Doctor, my husband told me my breath smells as fresh as when we first got married." Sometimes it's those small, effortless changes, no cost, no fuss, that make the biggest difference in keeping your breath fresh and your confidence strong every time you speak. Finally, there's one mistake I want to emphasize most, because it's the reason small oral issues often turn into big ones. Not visiting the dentist regularly, or waiting until symptoms appear before seeking help. I understand, for many people going to the dentist isn't exactly pleasant. Some fear pain, others worry about the cost, and some simply think, "I'm older now, why bother?" But what most don't realize is this. After 60, visiting your dentist every 6 months can help catch countless issues early, from small cavities and mild gum inflammation to more serious changes like oral tissue damage or chronic dry mouth. I once had a patient named Mrs. Parker, 73 years old. She came in because one of her front teeth felt slightly loose. But after examining her, I discovered she had chronic periodontitis that had been progressing silently for over a year. She told me, "I didn't feel any pain, so I didn't think I needed to come." Thankfully, with timely treatment and regular maintenance, we were able to save all of her natural teeth. The truth is, your mouth is like a mirror of your overall health. Even small changes in breath, gum color, or dryness can be early warning signs of deeper issues such as diabetes, sinus infections, or hormonal imbalances. That's why dental visits shouldn't be seen as just cleaning your teeth, but as part of your whole body care routine. Schedule a dental checkup at least twice a year. If you wear dentures, have your dentist check their fit and your gum condition. And if your breath suddenly changes or develops an unusual odor, don't try to mask it with mouthwash. Find out the real cause. Just a little proactive care today can prevent expensive and painful problems tomorrow. Because oral care isn't just about looking good, it's about preserving your quality of life, confidence, and joy in everyday conversations. So we've just gone through 8 common oral care mistakes that most women over 60 unknowingly make. From brushing too hard, skipping the tongue, neglecting dentures, letting the mouth dry out, overusing alcohol-based mouthwash, ignoring gum problems, failing to rinse after meals, to delaying dental visits. These habits may seem small, but over time, they quietly steal the freshness of your breath, and with it, a bit of your confidence when you speak. The good news is you can change that starting today. With just a few gentle adjustments, you'll soon notice a real difference. Your mouth feels more hydrated, your breath lighter, and your smile more natural. Try following the oral refresh routine I shared earlier. Morning. Brush gently, clean your tongue, and drink a glass of warm water. Midday. Chew xylitol gum and keep your mouth moisturized. Evening. Clean your dentures. Rinse with an alcohol-free mouthwash and let your mouth rest overnight. And don't forget, visit your dentist every 6 months to keep your mouth healthy and your breath naturally fresh. Because at any age, a confident smile and a pleasant breath are the most beautiful languages of warmth. If this video helped you realize something useful, type 1 in the comments or tap the like button to let YouTube know you care about your health after 60. And don't forget to subscribe to VitalAge Health so you won't miss the upcoming videos, where I'll share more science-backed tips to help you stay stronger, younger, and more confident every single day. Finally, I'd love to hear from you. Which of these 8 mistakes have you made before? Share your story in the comments. Your experience might be the gentle reminder another woman needs today. Thank you for staying with me until the very end. I'll see you again in the next video from VitalAge Health.